Hello, welcome back to my channel Cancer Zappers by Abba. If this is your first time to the channel, welcome. I am a board certified medical physicist who makes fun, educational, and easy to understand videos about the field of treating cancer with radiation. I realize many have never heard of medical physics or met a medical physicist, so hi. My role in the radiation therapy clinic is often behind the scenes, so I get to explain a lot of the insider techniques and science that makes treating cancer possible. Of course, not all I do is behind the scenes, so I'll also talk about those things and try to paint a complete picture of what we do. Trust me, you're gonna want to subscribe for the sake of friends and family and patients with cancer. It's time to learn how things work. Subscribe. 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 In today's video, I traveled across the globe via a flight called the Internet, and I landed in Singapore. There, I met a former radiation therapist by the name of Stephanie Liu. If you know of other questions and or side effects that patients may experience under radiation therapy, please feel free to put them in the YouTube comments. And as always, like and share with people you think might benefit from all this information. Like when people ask you, what do you do? And you say, I'm a radiation therapist. Do they know what that was?
Oh, I love that question, Eva. They'll go like, what do you do? And I'm like, I'm a radiation therapist. Oh, so you're a nurse? I'm like, yeah, kind of. Yeah, kind of like a nurse. Yeah, but we're like, how do we tell them? Like radiation therapist, but in their mind, nurse. Because you're helping me, you're keeping me happy every day. I see you every day and you're caring for me. You're a nurse. I mean, I'm honored. Like to all the nurses, if you're listening to these, like we respect what you do and I'm honored to be called a nurse. But I try my best to explain to them that we are individuals who are tasked to take care of you during your CT simulation and your daily treatments. And you guys have to bear with us from the start of your treatment till the very end. And we'll be like your contact person for any questions, or if you want to speak, if cancer treatment is a long one. And day in, day out, people always think that as a radiation therapist, we kind of get numb because we see so many patients and we don't feel for them, we don't empathize anymore. And I don't see it as that case, we see a lot of patients, but we also kind of follow them throughout their journey, and they have their ups, they have their downs. We have patients on their happy days, on their sad days, just like us, like we're all humans. We have our good days and bad days. And I guess it's our job to kind of like let them know that, hey guys, you got to keep going. Like, don't give up. You got to keep going. You're almost there. I know 3 weeks sounds like a lot more to go, but after 3 weeks, you have another 2 weeks. After 2 weeks, you only have 1 week. And after that, before you know it, you're done. And more often than not, at the end of the week, they will kind of like miss seeing us. And what's even better is that when they come for their follow-up, and if they do remember us, if they drop by the department just to say hi, that means a lot to us. And just to see them come back knowing that they're doing okay, that they are alive, going for their follow-up, that's important. And I think for a physicist, even though if you guys probably don't get to see this, but knowing that the treatment plans that you guys have done is amazing, is doing well for the patients. And I think, you guys could be really proud of yourself for what you guys do.
Yeah, special thanks to the dosimetry team as well for that. Thanks, Stephanie.
Sure.
But as a radiation therapist, what would you say were questions patients had for you, since you were interacting more with patients?
So when I was therapist in Malaysia, it's always what can I eat and what can I not eat? A misconception that when you have cancer, you cannot eat this, you cannot eat that. Everything has to be stopped. You have to go on a very strict diet. And I guess that was the most common question that we would get, apart from how can I care for the treatment area? So I would say that all of this knowledge, when we were working closely with our patients, we were also working closely with dietitians. And at the end of the day, that's how we provide a more holistic advice to the patient when we are seeing them very regularly on a day-to-day basis.
As radiation therapists, you treat different sites, but what are some of the answers you're given? Advice to people watching right now, how should they prepare?
So it really, like you said, it really depends on the site. If we're seeing like skin reactions mostly, if we are, and then for skin reactions, we all usually monitor the patient's progress. So we would take note of their skin reactions, and if it gets really quite adverse, we would refer them to the nurse in charge, and then they will usually give topical creams for the patient, or they will just teach them how to care for these areas. If you're treating areas like the pelvis, and then they would get side effects like diarrhea or discomfort, flatulence. So these are the kind of things that we would tell them that these side effects are normal. We would usually prepare them on the first day of treatment. We would prep them and say, these are the kind of things that you need to look out for in the future. So once you have it, just keep us posted. We would help you monitor. And then we would then like link you to the right channel that you need to see, for example, the nurse, or for example, the dietitian. So it really depends on what site that they're undergoing. For example, breast with bolus, and its skin could get somewhat red and warm. So we would then teach them how to make sure that don't wear any tight bras with any metal or any wires, keep it aired out, wear loose fitting clothes. And yeah, so these are the advice we would give the patient if it's pertaining to side effects.
What about head and neck patients?
Yeah, that's a good question, because over here in our region, we treat a lot of nasopharyngeal cancer, a lot of nose cancer patients. And because of the way that the beams go in, sometimes they will kind of lose some hair at the lower end of the back of the neck. So we would kind of warn them that this is normal. It's just the way that the beam goes into your body, and you might have a little bit of hair loss at the bottom, apart from your throat, sore throat, discomfort in swallowing. And we got responses from the patient. Some of them would say that, it's like swallowing glass, the pain that they feel. And usually at the third week of NPC treatment, they would say that, this is a time that the sore throat is getting worse, drinking fluids, and even taking the medication the doctor is giving, or even taking warm honey is not helping. And yeah, the definition is like swallowing shards of glass. And I guess for head and neck areas in particular, we would advise them that these are the common side effects. You should be prepared for this. And again, keep us posted about your progress and let us know if you need any additional help. Yeah, and also when hygiene, teeth hygiene, all of that, we would also take note.
And anything to be said about people whose lungs are being treated?
So for lung, it really differs. So with my experience in my center previously, we treat SBRT for lung, so lung cancers with very small tumor, and of course those with compromise with maybe a large portion of one sided of the lung that it's compromised. So that would be more of a palliative form of approach. So for the palliative patients, we usually have to help them with oxygen. It really depends on a case-to-case basis for the more severe ones. But for the radical treatments for SBRT, usually patients are good and they're able to breathe normally. And we usually treat them with gating, or if it's the tumor on the higher or upper lobe, and then we just treat them with an ITV. So no gating is involved, but usually they're able to breathe normally. However, if they do suffer from any shortness of breath or discomfort, again, we would just let them know that these are the normal side effects you will be experiencing for the treatment in this region. So
a lot of what I do is behind the scenes, except when I'm working with brachytherapy patients, like we treat a certain radioisotope called Zovigo. So I do get to talk with them and tell them what to do. It's very useful for them to know that, especially, coming in, they have no idea what to expect. They want to ask someone what to expect. Of course, they can talk with the doctor, the radiation oncologist, but since they see you every day, it really helps to, for you to just keep encouraging them daily. This is normal. This is what you will feel. This is what you can do to make it better. So yeah, that's really awesome. So what about the tattooing? A lot of patients ask about, whether they get tattoos. Like, what do you tell them?
We did tattoos in our site. So in radiation therapy during CT simulation, we have to position the patient every day in as comfortable as we can because they're going to be lying in this position, immobilized, the same way, day to day of their treatments. So we're talking about 3 weeks, 4 weeks, sometimes even 6 weeks or more when it comes to their treatment. So it really depends. That's why we want to make sure that they're in as comfortable as they can in this position and also as stable as they can. And most importantly for us, we can reproduce them on a day-to-day basis. So once we get them into this position, and I would take, say, lung cancer, for example. So once we get them in that position, we have their hands up. Because we're treating the lung, we want to avoid the beams going into the arms for it. So it's easier for the physicist to plan also. And then we'll just make tiny little dots, say on the side of the patient, one in the center and another one on the other side. And these 3 dots would just connect to each other. And we use lasers to kind of align this. So these dots are essentially reference points. And these reference points are points that we put where we assume to be closest to the treatment area that we're going to anticipate during treatment. So at these tiny tattoo points, we will just put these points right there. We put a ball bearing, and then we'll perform the CT scan. So it can kind of assist the physicists like, okay, we know that this is our reference point. This is the area that we're going to plan for. And from that reference point, if they want to make how many shifts to the ISO center for the treatment day, they would know. And then we would know on treatment day. Yeah, before we moved to surface guidance, it was mainly tattoos for the reference points. And yeah, so again, now this is quite different for our scenario because in Malaysia, we have Muslim patients and we also have patients who are like Chinese, Indian, what have you. So for the Muslim patients, they're quite conservative about the type of dye that we use for the tattoos, and it has to be halal certified. So we have to get like a special ink, and then this ink is certified by the government that is safe to use and for medical use, like such as tattoos for radiation therapy. So once this is approved by the government and we have like the certificate, usually they don't have any qualms about it. So tattoos, we just usually just prick the very top layer surface of the skin, tiny little dot, maybe 1 mm, I would say just very small, as long as it's clear and visible, and we just do 3 dots. We try to keep it as little as possible and as long as it's clear and a good reference, and then we just keep it as that. But later, when we start to move towards surface guidance, we try to eliminate the use of tattoos, for most patients.
So how are things in Singapore right now with the whole COVID situation?
Well, it's almost normal. Apart from the fact that all of us have to wear a mask on when we do our grocery shopping, when we go out dining. Of course, there's still like social distancing measures, and then the government will only like allow maximum 8 people per table or 8 person in a house. But apart from that, we're taking the bus, we are eating outside, we are shopping, we are, just it's almost normal. I would say we could go to the movies if we want. Wow. So yeah, I think
why is it so normal? Is it because people have always been following these precautions from the beginning and have been taking it very seriously with masks and distancing?
I think the Singapore government did a very good job from the beginning. They kept the numbers really low. Like you said earlier, you mentioned that because they had the experience with the pandemic, for example, the SARS last time, so they kind of had some history and experience on how to handle these kind of cases. So when it happened in Singapore, they knew what to do. They closed the borders. They were very strict. They had a circuit breaker measure that they imposed on us. And that was very strict. Like you can only like go out and purchase your groceries, no dining out, eateries and everything, they're all closed. And because of these measures from the beginning, they were able to contain the cases to very low numbers. So even until today, the community cases last few days, just one per day within the community, it's super low. And they're doing a great job. And one more thing, testing. They're doing a lot of testing. Yeah.
So are people being immunized, vaccinated? Are they receiving Moderna, Pfizer, any of that?
Yeah, that's a very good question. So they have started vaccination on the 30th of December. Sorry if I'm wrong, but they started that last year. And it's Pfizer. The vaccine that we're using is Pfizer. And they have started vaccinating the frontliners, those who are in healthcare and aviation, and also the older generation. So they're starting that, and they're hoping to get us all vaccinated by mid or the third quarter of this year. Yeah, they're rolling out pretty fast.
So would you say things are kind of the same in Malaysia? Or things are
different? Different, so different. My parents are in Malaysia. My parents and my parents-in-law, they're in Malaysia, and it's not looking too good right now. It started with very little cases, and then because they had a by-election and everybody attended the by-election with no mask on, no social distancing, and then the cases just skyrocketed. It went off the roof and it spread from one state all across to the whole peninsula. And right now it's 3,000 plus to 4,000 plus cases per day. And our death toll has, is 600 over yesterday. It's not looking too good. They are having a movement control order right now in Malaysia. So my parents are not able to just go out, dine out or anything. They can only go out in a pair to buy groceries and mostly confined in the comfort of home. So it's different. It's different in Malaysia.
Wow, night and day. Night and day. Wow. But I guess it shows you the power of wearing masks and social distancing, how never to let your guard down, not even for a second. It really makes a difference. A big thank you to Stephanie Liu for joining us on this episode. Stay tuned for more of what she has to say in another episode.